I'm Bob Pickett, the podcast CEOs you should know, and we're visiting right now with Daniel Siegel from Synergy Health Partners. Daniel, first question I'm going to ask you, if you explain to our audience, what exactly is Synergy Health Partners? Can you tell us a little about it?
Absolutely. First of all, Bob, thank you so much for having me. I'm excited to be here. This is great. The easiest way to explain what we do is to kind of imagine that you're living in New York City, you're an orthopedic surgeon, a trauma surgeon, and there is so much volume, patient volume in your hospital that you become burned out. It's very hard for you to take emergency call at night and then also visit with your elective patients the next day. On the flip side, you've got places like in remote rural areas like Glasgow, Montana, that can't recruit surgeons. They literally can't get the family, the spouse, the kids to move there. So you've got this huge gap between where surgeons are concentrated and where surgeons are needed. So effectively, what Synergy does is put programs together to alleviate that burnout for the active surgeons and reduce their workload and give them some work-life balance back. And then they redistribute those surgeons to places that most need the care.
So you're talking about a traveling surgeon, right?
Yes, it is a traveling surgeon. I think most people, when they think of traveling surgeons, they think of locum tenens, and it's a very different model. So happy to explain that as well. But it's yes, they do travel, but they're dedicated to that facility. So they'll travel in. Usually, it's teams of three folks. So it's a care team model. Kind of think of it almost like a fractional model, right?
Mm-hmm.
We understand a lot of like fractional CFOs these days, fractional marketing groups. These are fractional surgeons. So they'll each take 10 days a month and they'll go into that same community. They are really dedicated and become part of that care team. And then they take all the emergency call for that 10-day period, and then they go home and they're off, completely off for 20 days. And there's a coordinated handoff to the next surgeon who takes the next 10 days. And so that care team of three basically covers all of the needs for that community 24/7, 365. The beauty for the surgeon is when they're off, they're really off. So instead of busy, burned out surgeons who can't coach their son's little league teams, or we have surgeons that have climbed Mount Everest now since they've been part of our program, or they get to do mission work in Honduras, we actually allow them to continue to practice their passion of surgery, but also be able to pursue other things in their lives that is important to them as well.
Sounds like a perfect balance, actually, if you ask me. Perfect balance between work
That's the
and
beauty,
not burning out of anything of your job.
right? And who wouldn't want to work 10 days a month and get the other 20 off,
Yeah.
right? It's pretty amazing.
Well, what are the direct benefits for hospitals involved with this?
Yeah, so one of the challenges that hospitals face, there's a few different historical models. Hospitals love to employ their own surgeons, and that makes sense. And when they
Mm-hmm.
can, that's often the best model because they can kind of control the quality of the surgeons that they bring in and they can control the costs, right? And those are two major variables. Hospitals like predictability. Until the synergy type of model, and by the way, we call these surgeons surgical lists, right? They're surgeons that are dedicated to hospital practice. Before the surgicalist model, hospitals would rely on the travelers, these what they're called locum tenens often, which really literally means one who holds a place. It's almost like a substitute teacher, right? Somebody's
Right.
out for a couple of days, they need somebody just to come in and cover for that day. The challenge with the locums model in many cases, it's great if it's a short-term thing, maternity leave, somebody's going on vacation, right? They just need a break. That's great. A few days here, a few weeks there. But what happens is hospitals started to rely on locums long term. And the model for locums is not price specific. You get lots of it's almost like surge pricing in a taxi, right? So there were a lot of add-on fees, and so it was very difficult for CFOs to be able to budget accordingly. So Synergy brought some kind of calm to the chaos, predictable budgets. The other challenge with locums, it's a revolving door of surgeons, whereas Synergy has these dedicated teams. So from a hospital CEO's standpoint, it brought this ability to now have a predictable, consistent team and a predictable, consistent budget and take basically become the easy button for them. Just take the load off of having to worry about recruiting surgeons and manage that program.
Now, you've been with the company since 2021, correct?
That is right. Yes. Joined about 4.5 years ago.
We've talked about the benefits for surgeons, but let's talk about the benefits for patients' access to surgical care. How does this make it better for the patients?
So in urban communities, as we talked about a little bit earlier, there is a high density of surgeons, and that often is not a challenge, right?
Hmm.
Access is there. You might have to wait a little bit, but there's always going to be a surgeon available. But when you start moving out of the urban environments, even to some suburban areas where you've got a busy trauma center, and some of the surgeons, even there, might be burned out, you might not have enough trauma surgeons to cover all the emergency call. God forbid somebody falls off a ladder, car wreck, emergency appendectomy, which actually happened to my son in Santa Barbara,
Mm.
had to go to Cottage Hospital with a belly ache. And luckily, they did the x-rays, and sure enough, they rushed him into the operating room, and we were able to take care of him. But had there not been a surgeon on call, that could have been trouble. And so, in a lot, particularly as you get further out into some of the rural and more frontier communities, they have a hard time attracting surgeons. What that effectively means is the paramedics, if they know a surgeon is not there, they're going to drive to the next closest hospital. And that could be 100 miles away. So, what it does for patients is it actually allows the paramedics, the patients, their families to keep care local. So, our surgeons will actually be there when they need it most. And that's our whole mantra, is to keep care local for patients all over the country.
That's good. That's a good mantra right there. Great mission statement. Keep it local. Keep it there where they don't have to travel. I grew up in rural West Texas, so I can tell you our nearest hospital, the good hospital, was 40 miles away. I know exactly what you're talking about when it comes to rural areas and stuff.
I was just going to add, Bob, the other benefit to the community, and it's for the patients, it's for the hospitals, but it's the community at large, is that these hospitals are often the largest economic drivers of the community.
True. True.
And so if you're diverting ambulances to a different hospital in a different community, you're losing that revenue. You've got lots of jobs, not just the surgeon that's there, but the nursing staff, the techs, the anesthesiologists, right? The entire hospital has a huge fixed cost. So if you're not putting those operating rooms to use and taking care of those patients, you're losing valuable revenue. And there are so many hospitals right now, rural hospitals in particular, that are teetering on the edge of bankruptcy. And that's another part of the problem that we're really trying to solve.
Yeah. And of course, we all know that the pandemic reshaped hospital operations totally. Oh, what has changed for you since the pandemic and the company, though? How have you changed? How have you adapted?
Yeah, that's an interesting question. The pandemic, I think, really forced hospital CEOs to put first things first, right? As I mentioned, there are a lot of hospital closures since, just since the year 2000, there have been 226 hospitals that have closed. Today, as we sit here, there are another 430 at risk of closing. So these hospitals are operating on a razor thin margin, either slightly positive or sometimes quite negative. So I think hospital CEOs since the pandemic have really had to think outside the box about care coverage. They've had to introduce technologies that they were a little bit reluctant, like telehealth, for example. And they've also had to consider care models like Synergy, which is effectively leasing your surgical service line. I think a lot of hospitals would, again, prefer to hire themselves. Now they're like, oh, actually, this makes a lot of sense. It's, as I said, predictable expense, predictable team. So we've just sort of ridden that wave. I think we've been around since 2014 is when our first program launched, still up and running today. Still many of the same surgeons are practicing at that first facility. So we were sort of poised and ready. It just took a little, I think that pandemic really changed the mindset for a lot of hospital CEOs to be willing to try something new.
Yeah, which they've got to do something. It's survival, so to
That's
speak.
right.
You've got to survive. Now we talk about the pandemic reshaping hospital operations. Are there any other emerging service lines that Synergy's planning to support in the next few years? What's down the line?
Yeah, so our founders were orthopedic surgeons. And what's cool about Synergy is it's surgeon founded, surgeon led, and really is solving that surgeon shortage challenge in the world. So obviously, orthopedic surgery was our first foray, and that still represents probably 70% of our programs today. Since inception, we've actually launched 80 programs around the country. We're in 23 states. We've calculated that we've covered about 88,000 days, patient covered days that wouldn't have otherwise been covered. And back to kind of keeping revenue local and care local, it represents about $1 billion worth of retained revenue for hospitals around the country based on the Synergy program. So we're super proud of that. So orthopedics was the first. Then we started going around on listening tours with the facilities that we were already working with. They said, can you also do general surgery? So when I got here, those were the two service lines that Synergy offered, orthopedic and general. We also started on our listening tours, and I'm on the road about a week a month visiting some of these really interesting places around the country. Can you do anesthesia? Well, anesthesia is the gateway for surgery, right? If you don't have an anesthesiologist, you're not going to be able to do surgery. So we started an anesthesia practice. And then most recently, we've been asked to add gastroenterology, ENT, and urology. And those are interesting because they don't necessarily have full-time needs, but they might have, hey, can you bring someone in for 5-10 days a month? So that's more of sort of a mission style model, right? Where we'll bring folks in, they'll kind of cover those patients, do clinics, do procedures as needed. And then that hospital can kind of decompress that pent-up demand for those specialties. So that's what's on the docket today: orthopedic, general, and then recently added, and have a small anesthesia, but very quickly growing practice there: ENT, gastroenterology, and urology.
Well, one thing you can say about Synergy is you're listening to your customers and expanding. You're really leading the charge.
Well, it's amazing. The funnest part of my job is that week a month on the road, right? So I get to go to places like Hardin, Montana, or Glasgow, Montana. Actually, Glasgow was kind of a fun story. My business partner, who's the chief medical officer, practicing orthopedic surgeon, and I showed up in Glasgow. And the night before the meeting with the facility, and we went out to have a beer. There were 2 bars open, so we just picked one and sat down at the bar. And there was 2 people in the bar playing pool, and then the 2 of us. And the bartender looks at us. She goes, "You guys aren't from around here, are you?" We're like, "How could you tell?" And she said, "What are you doing here?" We said, "Oh, well, we have an orthopedic and a general surgery program at the facility. We're going to meet with Nick over there tomorrow." And she said, "Oh, that's so funny. I'll see you there. I'm a surgical tech." She's a bartender by night, surgical tech by day. And oh, by the way, she was born in the hospital. So it's really cool to spend time on the road and actually get to know the people that we're serving and how important that is, not just as an economic driver, but as a community hub for the folks that live in that area.
And what a great story. Now, you mentioned a couple of cities in the West. Is the West probably your biggest customer base right now where you're growing?
Yeah, so we're in 23 states, as I mentioned.
Right.
I would say, it's kind of from Oregon to Georgia. We're more concentrated for now. We have California and up the coast, Oregon and Washington, then across to Idaho. And then it goes all the way across the sort of upper states through to New York. We actually had a program in Maine, but sadly they closed their doors. They went bankrupt. This was kind of the sign of the times. And then down south into Georgia, Mississippi. So there's still a kind of central and southern. We're not yet in Texas, but we're working on it. We've got two active leads there. We'll get there soon. Maybe there's something we can talk about there. But not still again 23 states. So still a lot of the country to cover.
We're talking with Daniel Siegel, Synergy Health Partners, CEOs you should know. Let's talk about, I was looking at your LinkedIn profile. You have done a lot, and you started, developing businesses just out of high school.
Actually, in high school. Yeah, my first sort of, if we can call it a venture.
Well, I didn't want to talk about that one because you only sold two lights. But anyway, go ahead and tell our audience about it.
Fair point, yeah. Yeah, it was literally 2 lights. That's all we need to talk about. But it was my grandmother who bought them both, which was kind of cool.
Well, good. And your grandmother plays a big part of your success story, doesn't she?
He does actually. Yeah, it was interesting to kind of look back and think about that. I mean, in addition to buying the two lights for my first venture, my first sort of grown-up venture out of college, I went and traveled the world for 2 years right out of school. Lived for a year in Europe, a year in the Middle East, and came back and joined a buddy of mine, and we started effectively like the called Student Advantage. It was like AARP for the college market, and it was the two of us in the basement room, and I had no money, nowhere to live, and my grandmother was like, please come live with me. And so I did, and she put me up, she nourished me, she housed me, and the best though is she grounded me. So I would leave in the morning, 20s, early 20s, thinking I'm kind of a hot shot heading off to a big meeting for the day, and she would say, honey, good luck today. Go get them. And by the way, where's your scarf? It's cold out there. And, she just like, she wouldn't let me forget, what mattered most. And so I'm always grateful to her. I mean, she grew up in an orphanage. She has a crazy backstory. And with all that she had been through, she just knew how to keep it real. And I bring that to my team. I try to do that, and everything we do every day is just keep what matters most top of mind, and not sweat the small stuff.
Yeah, yeah, that's what a great story and what a great inspiration for you, also, Daniel. Really good. Hey, listen, is there
Thank you,
anything?
Bob.
I always ask our interviewers this question: is there any books that you would recommend to any future CEOs? What was your biggest inspiration that you've read? An author?
Yeah, so there are some classic ones. Good to Great is out there. Jim Collins. There's one called Finding the Space to Lead, which I enjoyed quite a bit, called by Janice Maturano.
Hmm.
But one, CEOs, especially entrepreneurs, go through a lot of life transitions. If, the best case is things go well and you end up selling your business. And then you're like, that was great. Now what? So we spend so much of our time as entrepreneurs in transition. And there was a great book, this guy out of Brooklyn that I read called Life is in the Transitions. I actually recommend it to anybody who's going through any type of life change or transition, but particularly for entrepreneurs. And it's basically mastering change at any age. And he talks about, it's a lot very data driven and very insightful. And it makes you feel like you're not alone when you're sort of struggling to figure out how to get through a difficult time.
Any
It's by
podcasts that you'd recommend also besides books?
I heard there's a great one called CEOs You Should Know.
Yeah, I knew you were going to say something like that. Oh,
uh, no, I mean honestly, this is maybe kind of lame, but work is so insane these days. I
yeah.
mean, rural healthcare is just literally all consuming. So when I'm kind of done here, I go home with my family. I hang with my labradoodles. Like I try to find some chill time and disconnect a little bit.
Well, I was going to ask you, how do you relax? Because you're always so busy.
I've always been drawn to the mountains, so I try to go ski and snowboard as much as possible. I've actually got a trip up to Whistler coming up in a couple of weeks with some old Michigan buddies. I'm a big paddle boarder, and so I like to take the doodles out on the paddleboard. I've taken all three of them at once. That was a
Oh
bit of a
boy.
mess. Yeah, one would jump in, then the other, and then the other, and I'd just be trying to pull them all back onto the board. It was kind of fun. But yeah, just trying to get out into nature. Living in New York City, nature, you got to kind of work a little harder to find it, but
Right.
there's rivers, there's parks, there's trees all around. You just, I sometimes I look out of my window and look at the buildings and imagine that they're mountains. So, I do what I can to, to try to find my peace in the middle of the chaos.
Now, that's a great vision right there. We're talking with Daniel Siegel, Synergy Health Partners. And Daniel, is there anything that you'd like our listeners to know either about Synergy or maybe some trends that you're noticing in the healthcare field? Early insight.
Yeah, Bob, one interesting observation, and it's not really related to synergy, but maybe an opportunity for, one of your entrepreneurial listeners. While I'm out on the road, especially in some of these rural and frontier communities, one of the other things that we often get asked for is for OB, labor and delivery.
Right.
And so we're not currently doing that. And the other thing that people always talk about are nursing home closures. And it's interesting. They're at opposite ends of the spectrum, but both closing for similar reasons. Basic economics, right? It's a high fixed cost to run those two types of services. Hard to find labor, especially on the labor and delivery side of things, and the reimbursement is really low. So it's just a bad business. So unfortunately, what I'm starting to see is that in these smaller towns, you can't be born there and you can't die there, and that's just a kind of a
Mm.
sad state of affairs. But again, I'm hopeful that maybe this is my future endeavor that I'll take on, or like I said, maybe one of your listeners wants to figure out how to kind of solve that riddle and allow those rural and frontier communities to thrive.
That sounds like a growing problem that somebody needs to solve. You're right. Daniel Siegel, Synergy Health Partners. If somebody wants to get in touch with you or know more about Synergy Health Partners, how would they reach out?
So they can come on our website, choosesynergy.com. They can also email me directly, dsiegel, Siegel, @choosesynergy.com.
Great way. Well, I appreciate you appearing on the podcast, CEOs You Should Know. Daniel Siegel, Synergy Health Partners.